My name is Michelle, and I'm a recovery coach, peer support at the Center for Hope. I'm Rosie's grandma, first and foremost. I'm my kids' mom. I'm a mentor. I'm a friend. I'm a daughter. I'm a sister. I'm someone who is trustworthy and safe. My first encounter with opiates was I want to say I had a kidney infection, and I went to the emergency room because I didn't know what was wrong with me. I just had really bad side cramp. I was probably late teens. I had really bad cramps in my side and didn't know what was wrong and went to the ER, and they told me I had a kidney infection and prescribed hydrocodone, I believe. It was a long time ago, so I'm pretty sure it was hydrocodone. And I didn't take them all. And I remember once I felt better, I still had some in my purse, and I took them anyway. And I was like, "Yep, all right, yeah, I like this." So I would describe active addiction. I read something the other day, and it said, "Imagine being in a burning house, and instead of trying to get out and save yourself, you're trying to redecorate." And it kind of hits the nail on the head. It's yeah, it's rough.
Is that say
I think once you get to the addiction point, the house is on fire at that point, and you don't even realize it before it's too late. Yeah, I was in full use. Oh, my recovery journey. I was in full use for 18 years. I pinpoint at 23 to 41, and my recovery journey started when I started getting arrested. I started committing crimes, landed in jail, and that's where my recovery journey started. It was I was charged with some victim crimes and was told I was going to prison, and I was ready for it. I had applied for this thing called drug court. I didn't know what it was. I had never been to treatment. I had never sought help. I had never, up until that point. But I was told people with my charges go to prison. So that's what I thought was going to happen. But by the grace of God, I was sentenced to felony drug court in 2018. I was released. Did really well on the program. I was a sponge. I had needed treatment for a really, really long time. And I loved my drug court days. A lot of people don't say that, but I can honestly tell you, they were some of the most terrifying and beautiful, genuine days I'd ever had in my whole life. Because I had never been sober up until that point. So, yeah. Yeah, I had dabbled in junior high. I had smoked weed and drank alcohol for the first time in 8th grade. And ever since, we'd always trying to find something, find the next this, find the next that. But it wasn't until my early 20s, and a back injury is what got me hooked on opiates. I didn't know what addiction even was. So,
and how long?
oh gosh, I want to say it was probably about a year before I realized I was actually addicted, because I remember running out and getting sick and being like, what the heck is even happening right now? So that's how I knew I was addicted. It's really bad. And I always thought, I was always naive about it. I always thought if I could just get past the physical withdrawals, then I won't do it again. I'll be fine. I just got to get past those withdrawals. I never could make it past them. I think I did once or twice, but made no attempts to get treatment of any sort, and ended up going right back. So the financial piece to it I wasn't worried about it. I would overdraw my bank accounts. I would write bad checks. I just, whatever I had to do to not get sick. I hid it for a very long time, and caused a lot of damage. A lot of damage. What helps me to continue in recovery is I have an amazing foundation for my recovery. I started it in drug court and just continued to stay plugged in, continued to volunteer, continued to go to meetings, and then it became my job. So that's my driving force. Other than my family, of course, my kids are amazing. I have a 4-year-old granddaughter. Her name's Rosie. She turned 4 yesterday, and she's literally my best friend. And I can't. I'm gonna get emotional. I can't imagine living without her or her living without me. She's the best. She really is. That I would tell someone in the midst of active addiction that there is help. There's a lot of help. I think that's one thing that kept me sick for so long. My ego got in the way a lot, but I didn't realize that addiction is a real thing and it's treatable, and that it's okay to ask for help. And I would tell them that you're not alone. There's a lot of us ready to welcome you. Mostly just that they're not alone. You feel really alone and really defeated. Even when you're using, it's not right. But that feeling of defeat and aloneness it's a death sentence. I would want people to know that we're people too. And recovery is a beautiful thing. It's something that people shouldn't be afraid of. Some of the best people I've ever met in my life are recovering drug addicts, but to try not to have stigma and try to think openly and maybe reach out a hand to people that need it, because that's what people need is a hand. I think the community can participate. We offer a lot of services, and it's not just for addicts. We have a lot of community events, a lot of conversations, a lot of softball games, a lot of barbecues, a lot of fundraisers. We do a lot of things, and it's known that we're in recovery. I encourage people to participate and educate themselves, and I think it would make a world of difference. I think people would be able to see we aren't that bad. We're pretty all right. There's actually a lot of resources in the community. Narrowing it down to 3 is actually kind of hard. But the Center for Hope does provide Narcan free of charge, no questions asked. We have a box in our lobby, and anyone's welcome to come and grab some if they need it or know someone that does. The Crisis Center is a great resource for people wanting to get into treatment or looking for resources, or even just a place to decompress and get your thoughts together and figure out what you want to do. It's a safe place for that. And then it's co-located with the Center for Hope. And we're like the human side of addiction. We get to do all the fun stuff, like the recovery meetings and the pro socials and all that. So the Center for Hope is always a great resource. We have parents of teenagers and young adults that come in looking for help, and we touch a lot of different people, and it's actually really great. And there's a lot of counseling centers on substance use centers. There's RHS is a really great one that I recommend. To be there. People a lot of times they just need a shoulder. They need support. They need that connection, because it sounds cliche, but connection really is the cure to addiction. I believe humans are wired for connection. I think it's the outside factors that desensitize us of that and make us think we don't need that connection, because humans are pack animals, I think. But be there for somebody, reach out to somebody. I think people would be surprised the difference it makes when someone just says you're not alone and let's get you some help. What I thought about Narcan, especially before becoming a recovery coach, is I looked at it as enabling people, as giving them permission to use, which made it easier for them. That was my thoughts. But in all actuality, Narcan is giving people permission to save their lives, to give them another chance to possibly live a clean, healthy life.